Nutrimentor. If you are preparing for CPGET, this is one topic you simply can't afford to skip. Clinical nutrition may look vast, but the questions are often based on few high-yield concepts. In this video, we'll revise most important and repeatedly tested MCQs in a simple exam-oriented way. Pause each question, think of your answer, and then check the explanation. Let's start our rapid revision of clinical nutrition. Kwashiorkor is primarily caused by deficiency of, and the options are carbohydrate, protein, fat, or is it vitamin C? Let's start with one of the easiest exam favorites. If you hear edema in malnourished child, don't think calories first. Think protein deficiency. That's our biggest clue. And the right answer is protein. Kwashiorkor results from severe protein deficiency despite relatively adequate calorie intake. Edema is its characteristic feature. Which feature is characteristic of Kwashiorkor? And the options are severe wasting without edema, or is it only edema, hyperglycemia, or goiter? One word can solve this question. Swollen feet, swollen face, swelling anywhere in a malnourished child. The examiner wants you to say Kwashiorkor. Yes, the right answer is edema. Bilateral pitting edema is a hallmark of Kwashiorkor. Marasmus results from deficiency of, and the options are protein only, energy in protein, iron, or vitamin D. Now compare this with the previous question. Here the child doesn't just lack protein, they lack everything. Think overall starvation, not just one nutrient. And the right answer is energy and protein. Marasmus is caused by severe deficiency of both calories and protein, leading to extreme wasting. Which clinical feature best differentiates marasmus from Kwashiorkor? And the options are fatty liver, edema, severe wasting without edema, and skin lesions. Here is the classic comparison question. One child is swollen, the other is simply skin and bones. That's usually enough to pick the correct answer. The right answer is severe wasting without edema. Marasmus present with marked muscle and fat wasting but no edema. Which of the following nutritional disorder is characterized by edema, moon phase, fatty liver, and skin changes? And the options are marasmus, Kwashiorkor, marasmic Kwashiorkor, or pellagra. This is a classic identification question. Instead of asking the disease directly, the examiner lists a group of signs. Look for giveaway clue, edema. Once you spot that, the answer becomes much more easier. Yes, the right answer is Kwashiorkor. Kwashiorkor presents with edema, fatty liver, dermatosis, sparse hair, and characteristic moon face due to severe protein deficiency. Which anthropometric index is most useful for identifying central obesity and predicting cardiovascular risk? And the options are BMI or body mass index, waist circumference, height for age, mid-upper arm circumference. Here where students get trapped. BMI tells you whether someone is overweight, but if the question specifically mentions heart disease or metabolic risk, think beyond BMI. The clue is where the fat is stored. Yes, the answer is waist circumference. It reflects the abdominal or visceral fat, which is more strongly associated with cardiovascular diseases and metabolic syndrome than BMI alone. BMI is calculated using which of the following equation? Just pay attention towards the equation. Right answer is weight in kg by height in meter square. It is used to assess the nutritional status in adults. According to WHO, obesity is defined as, and the options are BMI more than or equal to 25, more than and equal to 27, or BMI more than 30, or BMI more than 35. Students often mix up overweight and obesity. Remember WHO BMI classification while attempting this question. A small difference in cutoff values can change the correct answer. The right answer is BMI more than 30 kg per meter square. WHO defines obesity as BMI more than 30 kg per meter square. Obesity develops when, and the options are energy expenditure exceeds intake, energy intake equals expenditure, energy intake exceeds expenditure, protein intake exceeds carbohydrate intake. Focus on the basic principle of energy balance. Think about what happens when calorie intake and calorie expenditure remain unequal over a long period. Then choose the best answer. Yes, the right answer is energy intake exceeds expenditure. That is nothing but the positive energy balance. Which of the following is a major long-term complications of uncontrolled diabetes? And the options are osteoporosis, diabetic nephropathy, peptic ulcer, or rickets. Think beyond the immediate symptom of diabetes. Competitive exam often tells the chronic complications that develop after prolonged uncontrolled blood glucose. Choose the option that represents a well-known microvascular complication. And the right answer is diabetic nephropathy. Persistent hyperglycemia damages blood vessels, leading to complications such as nephropathy, retinopathy, neuropathy, and cardiomyopathy. Which dietary fiber has the greatest benefit in improving postprandial blood glucose levels in diabetes? And the options are insoluble fiber, soluble fiber, animal fiber, cellulose only. Imagine glucose entering the blood slowly instead of rushing in. Which type of fiber creates that slow release? And the right answer is soluble fiber. Soluble fiber slows gastric emptying and glucose absorption, improving glycemic control. Which of the following is an absolute indication for enteral nutrition? And the options are functional gastrointestinal tract with inability to eat orally, complete intestinal obstruction, paralytic ileus, severe intestinal ischemia. Here is an application question. The patient can't eat, but the intestine is working perfectly. Should nutrition go through the vein or through the gut? Remember one golden rule. If the gut works, use it. And the right answer is functional gastrointestinal tract with inability to eat orally. Enteral nutrition is indicated when the gastrointestinal tract is functional, but oral intake is inadequate. Which nutrient is most commonly restricted in chronic liver disease with hepatic encephalopathy? Options are carbohydrate, protein, vitamin C, sodium. Think clinically. In liver disease, protein is usually beneficial, but there is one condition where too much of protein can worsen the condition, and this is the clue. The right answer is protein. Protein intake may be restricted in hepatic encephalopathy to reduce ammonia production. DASH diet is mainly recommended for. Options are diabetes, hypertension, liver disease, or is it renal failure? If you see the word DASH in the exam, immediately connect it with one disease. That's nothing but hypertension. The most important dietary modification in hypertension is increase sodium, reduce sodium, eliminate protein, or restrict carbohydrate. This is one of those one-line revision questions. Hypertension. Your brain should immediately say less salt. So the right answer is reduce sodium intake. It helps in lowering the blood pressure. Protein intake is commonly modified in chronic kidney disease because kidneys are responsible for, and the options are digestion of protein, nitrogenous waste excretion, fat absorption, vitamin synthesis. Think function before diet. If the kidney removes waste, what happens when it fails? Waste accumulate. That's why protein intake often needs careful adjustment. The right answer is nitrogenous waste excretion. Damaged kidney cannot efficiently excrete urea and other nitrogenous waste. Which electrolyte often requires restriction in renal disease? And the options are potassium, calcium, iron, or zinc. If the examiner asks one electrolyte in kidney disease, don't search the whole periodic table. Potassium is the most commonly tested. So the right answer is potassium. Hypokalemia, or a condition where the potassium levels are abnormally high in the blood, is common concern in chronic kidney disease. Bile plays an important role in, and the options are protein digestion, fat emulsification, starch digestion, vitamin C absorption. Think about primary function of the bile in digestive process. Competitive exam often test whether you know which nutrient requires bile for efficient digestion. Choose the option that best matches this role. And the right answer is fat emulsification. Remember this connection. Liver makes bile, bile helps fat. No bile, fat digestion becomes difficult. Enteral nutrition is preferred over parenteral nutrition when? And the options are gastrointestinal tract is functional, patient is unconscious, patient has diabetes, patient has hypertension. Focus on the patient's gastrointestinal function rather than medical condition. In clinical nutrition, the route of feeding is primarily decided by whether the digestive tract is able to function effectively or not. Yes, the right answer is gastrointestinal tract is functional. If the gut works, use it. Enteral nutrition is safer, cheaper, and maintains gut integrity. Which of the following is most appropriate nutritional route for a patient with severe burns who has functional gastrointestinal tract but cannot eat orally? And the options are total parenteral nutrition, peripheral intravenous glucose, enteral tube feeding, oral nutrition supplement. Here is an application question. The patient cannot eat, but the intestine still works. Before looking at the option, ask yourself one question. If the gut is functional, if yes, the answer almost reveals itself. Yes, the answer is enteral tube feeding. When the gastrointestinal tract is functional but oral feeding is not possible, enteral nutrition is preferred because it maintains gut integrity and reduces complications. So let's finish with one last rapid revision. Remember, Kwashiorkor means edema, while marasmus means severe wasting without edema. BMI is simply weight divided by height squared. Obesity develops when energy intake exceeds energy expenditure. In diabetes, think carbohydrate control. In hypertension, think sodium restriction. Renal diseases means watch protein, fluid, and electrolyte. Liver diseases affects metabolism and fat digestion because of reduced bile. And finally, never forget this classic exam line. If the gut works, use enteral feeding. If the gut doesn't work, choose parenteral nutrition. These are quick recall points that can easily help you answer one or two questions correctly in the exam. And that's a wrap for today's clinical nutrition revision. I hope these high-yield MCQs and quick revision points make this topic much easier to remember during your exam. If you found this video helpful, do like, share it with your friends preparing for CPGET, and subscribe to Nutrimentor for more exam-focused revision content. Thanks for watching. Keep revising, stay confident, and I'll see you in the next video. All the very best for your CPGET exam.